Hello friends, today I will talk about this trend of self-medication. So it is not uncommon today that people go to pharmacy when they have any symptoms, they purchase the medicines and start taking on their own without consulting a doctor and without a doctor's prescription. Now what are the pitfalls of this kind of practice? So what I can think, there are three common pitfalls or three common dangers which can happen with this kind of practice. Number one is that, as a person, as a layman, if you don't consult a doctor just based on symptom, you cannot make a specific diagnosis. Just to illustrate, if you have fever, you can maximum take paracetamol, but the fever can be due to malaria, typhoid, dengue, TB and many other causes. So unless you treat the root cause, the disease will not get cured. So that is one danger of self-prescription. Same thing, for example, if you have stomach pain, you may go and take anti-acidity medications. But again, stomach pain can be due to multiple causes. It can be due to peptic ulcer. It can be even infections, gut infections. In rare cases, it can be cancers also. So what I mean is that unless a doctor evaluates and comes to a specific diagnosis and specific treatment is given, you may not expect a complete cure. And if you try self-medication, there could be delay in consulting a doctor and a delay in diagnosis, which can make the overall success even more difficult. The second problem is side effects or the adverse effects of the drugs. Because as a lay person, if you are not a trained medical practitioner, you may not be aware of the side effects. So every drug can have side effects, right from paracetamol up to PPIs, which are commonly used for treating acidity. So if you go through the literature, there are several side effects. So if you are experiencing a side effect, you may not be aware that it is related to the drugs. You may think that it is another problem. So tackling the adverse effects also can be a problem. And sometimes these adverse effects can be even severe. It can result into hospitalization and very rarely into liver or kidney damage and even death. So again, it's important to discuss with the doctor and then discuss all the possible side effects so that you can safeguard if you are to experience any of these side effects. The third problem I see with self-prescription is the cost. Now, one of the reasons why people may bypass the doctor is they may feel that they can save money, because consulting a doctor means paying the consultation fees. Sometimes tests may be written, so the cost of those tests. So by directly taking the medicines, you can bypass these costs. But then if suppose you are to have some adverse effects, or sometimes the disease is not diagnosed, then the cost of treating them, including hospitalization, can be even more. And nothing is more important than your own health. So what my message to all of you is that, okay, if you feel that symptoms are very mild, you may wait for a day or two, like say fever, for example. It is viral fever, you could wait for a day or two. But before you self-diagnose yourself with a condition and self-prescribe, always consult a doctor. You may not be able to get the doctor's appointment. In that case, you can consult other doctor also for a while, till you meet your regular doctor, and then discuss about the possible diagnosis and how long you have to take the medication, because you won't know how many days you have to take the medication. Also the dose you may not be aware of, because the dose varies from person to person based on the gender, age, body weight and any comorbid conditions. So that is why it is always good and safe for you to consult a doctor and then start taking any medications.